Hello, my name is Pablo Pong, and my topic is Isoniazid preventive therapy in HIV infected pregnant and postpartum women. Definition of isoniazid. Isoniazid is used in treatment of tuberculosis, and due to its efficacy and low cost, it's considered a drug of first choice. Isoniazid is more effective and less toxic than other anti-tuberculosis drugs, including paniminosalicylate acid, capreomycin, cycloserine, ethionamide, and kanamycin.
There is significant co-occurrence of HIV and TB, and people that have compromised immune systems are at greater risk for acquiring tuberculosis. It's our job to make sure that people who are living with HIV are screened and tested for tuberculosis, and that for people who we know are diagnosed with tuberculosis are tested for HIV. We also know that there are effective preventive therapies for TB among persons living with HIV. And this is one of the areas that we're really excited about at CDC. We seek, in a very short period of time, to rapidly increase the numbers worldwide, and especially in Africa, of persons living with HIV taking tuberculosis preventive therapy that can stave off development of active TB disease and save significant number of lives.
Application in medicine. Isoniazid inhibits a series of enzymes that mycobacteria need to synthesize mycolic acid, preventing the formation of bacterial wall. However, the exact mechanism of action is unknown. Isoniazid inhibits plasma monoamine oxidase, but not mitochondrial MAO1.
Tuberculosis is the leading cause of death in people with HIV infection because, number one, it's the most common HIV-associated opportunistic disease. And secondly, if untreated, it damages the lungs, renders people susceptible to other more disseminated forms of disease. And in the absence of treatment, they don't do well, and also, very importantly, transmit the disease to others in close proximity to them. So it's really essential that we find people, offer them the treatment, get them cured, and interrupt that chain of transmission at the same time that you're making them better.
Okay. The cons. Since the recognition of HIV and AIDS around 30 years ago, it has claimed millions of victims, in particular in poor countries where it mainly affects young people.
Antiretroviral medications are used to prevent the perinatal transmission of HIV from an infected mother to her baby. But this benefit needs to be weighed against the potential toxicity and adverse pregnancy outcomes associated with combination antiretroviral therapy. The PROMISE trial enrolled 3,529 women in the second trimester of pregnancy who had asymptomatic HIV infection with a CD4 count of 350 or more and randomized them to one of three groups. The zidovudine alone group received zidovudine during pregnancy, a single dose of nevirapine intrapartum, and tenofovir M-tricytidine postpartum. The zidovudine ART group received combination zidovudine, lamivudine, lopinavir, ritonavir during pregnancy and postpartum. And the tenofovir ART group received combination tenofovir, M-tricytidine, lopinavir, ritonavir during pregnancy and postpartum. Rates of discontinuation due to toxicity were low across all groups. The primary outcome was the percentage of neonatal HIV infections, measured 1 week postpartum. An interim analysis of the study demonstrated that the rate of early transmission of HIV was 1.8% in the zidovudine alone group, as compared with 0.5% in the combined zidovudine ART group and 0.6% in the tenofovir ART group, both significantly lower than in the zidovudine alone group. However, the zidovudine ART and tenofovir ART groups had higher rates of maternal chemical abnormalities than the zidovudine alone group. Zidovudine ART and tenofovir ART were also associated with more adverse pregnancy outcomes, such as low birth weight and preterm delivery. The authors conclude that combination antenatal ART resulted in significantly lower early HIV transmission than zidovudine alone, but at higher risk of adverse maternal and neonatal outcomes. Full trial results are available at nejm.org.
Issue applied in Ecuador. In Ecuador, the Ministry of Public Health report in 2017 49 in cases accumulated from 1984 to 2016 of HIV and AIDS.
How HIV treatment works. HIV treatment is another name for medication. There are many types of HIV medication called antiretrovirals, which work in different ways and combinations. The aim of treatment is to make it harder for HIV to copy itself and spread to other cells. The goal of it is to reduce the amount of HIV in the blood so that it cannot be detected by tests. When should you start your HIV treatment? Not everyone needs to take treatment. Your doctor will help you decide when the best time to start is. People generally start treatment when their CD4 count is low. This is the number of CD4 cells per cubic milliliter of blood, which in the UK means below 350. Sometimes doctors may start treatment before if there is additional risk, such as during pregnancy. How does the medication work? HIV treatment involves taking anti-HIV drugs every day. The best way to make sure treatment works is through adherence. Adherence means following the doctor's plan exactly for how you are supposed to take your medication. A combination of drugs prevent HIV from copying as quickly. By slowing down HIV, the body has more time to make CD4 cells to help fight off infection and keep the immune system strong. All anti-HIV drugs try to prevent HIV from copying itself. The different types of drugs do this in 4 different ways. 1. Stop HIV from entering CD4 cell. These are called entry inhibitors. 2. Stop HIV from changing its structure when it prepares to copy. These are called nukes or non-nukes. 3. Stop HIV that is already in the CD4 cell from getting to the place in the cell where it can copy. These are called integrase inhibitors. 4. Stop HIV from copying. These are called protease inhibitors. What about medication for children? HIV treatment works in the same basic way for children, but since children's and young people's bodies are still growing, there are not as many different types of medication available. Whatever age you are, it is really important to take HIV medication at the same time each day, because the medication only works for a certain length of time. If you take it late, there is a risk it will not be as effective. If you miss a lot of doses, your body can build up resistance to the treatment, and you may not be able to take that combination anymore. There are only a certain number of combinations available to take, so it's important to avoid resistance. If there is something making adherence difficult, it's good to talk this through with someone, maybe a friend, family, or your doctor. Although there is still no cure for HIV, with good adherence and many different antiretroviral drugs, it means that people with HIV are living long and healthy lives. For more information on HIV, please take a look at our online library.
In conclusion, most HIV medications are safe to use during pregnancy. In general, HIV medications do not increase the risk of birth defects unless the risk of any known side effect to a pregnant woman or her baby is greater than the benefit of the treatment.
If you have HIV/AIDS and find out you are pregnant or think you may be pregnant, you should let your healthcare provider know as soon as possible.
Some HIV/AIDS medicines may harm your baby. Your healthcare provider may want you to take different medicines or change the doses. It is also possible to give HIV to your baby. This is most likely to happen around the time you give birth. For this reason, treatment during this time is very important for protecting your baby from infection. Several treatments may prevent the virus from spreading from you to your baby. Your healthcare provider can recommend the best one for you. Your baby will also need to have treatment for at least the first 6 weeks of life. Regular testing will be needed to find out if your baby is infected.
Thanks.